Good afternoon, everyone. Welcome back to the Smarter Together webinar series hosted by Georgia Tech Smart Cities and Inclusive Innovation Initiative. This series connects you with important community impact projects that are happening now across the state of Georgia. I'm Greg McCormick, Georgia Smart Communities Challenge, and today we have with us the Georgia Smart team from Macon-Bibb County, one of our 4 Georgia Smart communities from this past year. They'll be presenting their final outcomes from their year-long Georgia Smart project that started last September. As an attendee, your audio and video are automatically muted for the duration of the event. However, we will take your questions after the presentation, so please feel free to leave your written questions in the Q&A area of BlueJeans, and we'll answer them after the presentation time. Today's presentation slides and a recording of today's event will be made available on our website for later viewing. Our 4 Georgia Smart teams would have presented their final presentations at our Fall Georgia Smart workshop, but we are happy to have them present to you virtually here throughout the month of September. This is the last Georgia Smart presentation for September, and next week we will be transitioning the Smarter Together webinar series back to bringing you new researchers from Georgia Tech to talk about important topics in technology and society. So check back on our website tomorrow for the fall lineup. So again, I would like to welcome the Macon-Bibb team and their Smart Neighborhoods project. I'd like to welcome Dr. Keith Moffitt, Macon-Bibb County Manager, to kick off the presentation. Welcome, Dr. Moffitt.
Well, good afternoon. Thank you for having us today. Again, I'm Keith Moffitt, County Manager for Macon-Bibb County, and it is my pleasure to have our team present to you our project. It's been an exciting time here as we are seeing this dream come into reality. I kind of started this process with my IT department in just kind of hearing about what smart cities are and knowing that we had a significant amount of projects that kind of qualified under the smart city umbrella. And so bringing all that together at the same time that we were notified of this grant opportunity, and my team immediately jumped on it. We put some ideas together, and today you will see again, the dream become a reality as far as how this project is going to be implemented in our community. So with that, thank you for having us, and enjoy the presentation.
Thanks, everyone, for that introduction, and thank you, Dr. Moffitt, for kicking us off. And I'm Dr. Arthi Rao. I believe I have a lot of echo on my. Give me 1 second. I'll just keep going. Greg, I think I'm going to have to rejoin the meeting.
Understood. Thanks, Artie. While she steps away, I'll just try to introduce all the project players that were a part of the Macon-Bibb project team. Obviously, Dr. Artie Rao, who you just heard from, is the Georgia Tech researcher who's been working with the Macon-Bibb team over the course of the past year. You also heard from Dr. Keith Moffitt, County Manager and project sponsor, who put the initial project together. The project lead throughout the year has been Joe Nabhan, and he's been supported by the IT director, Brett Lavender, in the county. We're also going to have with us this afternoon Carol Babcock, who's with Navicent Health and the Health Communities Advisor for the project. You'll hear about the partnership that the team has built with Carol across the Health Services Network in order to bring important community information from the city government to specific locations within the community, and putting that information in health centers and hospitals has really been one innovative concept come up with. So Carol will be able to speak to that. There's been a lot of other players that have been involved within the project and obviously supported all the way at the top with Mayor Reichert, who's been very instrumental in pushing smart cities and IoT projects in Macon and in the county. He's a real inspirational leader when it comes to smart cities project. He's been very involved, and we've been thrilled to have been working with him for the past several years. So, Artie, are you ready to continue the presentation?
Yes. I apologize. Can you hear me, Greg?
Yes, we can. Thanks so much. Back to you.
Okay, I apologize about that. So, Greg, thank you for that. I'd also like to specifically call out the help that the tremendous help that we've received from our project advisory board. Of course, Carol is with us today, and Julie is not in person, but she has definitely contributed tremendously to the project as well, and we'll talk about how she helped a little bit later in the presentation. And we'd also like to thank our summer intern, Jen, who was, again, a tremendous contribution to the project. So moving on. Next slide, Greg. A little bit about what got us started on this journey. And I think a big component of this project was really looking at digital equity. So when we looked at the numbers within what's happening in Macon-Bibb County, we saw that Macon-Bibb, 1 in 3 Macon-Bibb households had no access to broadband internet, and 1 in 5 households have no access to a computer or smart device. So the question that was driving this project was really, how do we get participants or residents in these communities to participate better in city government decision-making processes if they didn't have access to the services that was critical in making informed decisions and really having meaningful community engagement. Next slide. So the concept of digital equity is not one that was alien to Macon-Bibb. It was really nice to see that they had already embarked on this journey starting back in 2017. And they had a number of initiatives already underway. And this was one more milestone in that journey. And there were specific challenges that were associated with some of those smart initiatives. For example, they had a lot of smart solutions applications available. They had a Macon Insights Open Data Hub. They had several other applications such as the See-Click Fix, which meant that residents could go online and report any issues that they saw in their neighborhood, etc. But a lot of these applications were out of reach for several Macon residents simply because when you don't have access to the internet, there's no way that they can meaningfully participate or even consume the data or information that is being supplied through these smart apps. Another really neat aspect was they had the academy, the Macon Insights Academy, which was actually training leadership and other stakeholders in becoming savvy consumers of data. So as you see, we had already the building blocks of digital equity initiatives already in place in the community. Now it was about addressing those specific access issues. Next slide, Greg. So the first step was to look at how Macon-Bibb compares to the rest of the country in terms of digital equity issues, and what are the disparities even within the county in terms of digital access. So through some initial mapping and data collection from the census, you can see that from a nationwide comparison, that red circle on the national map shows that Macon-Bibb is probably in the second quartile of digital connectivity, which means they're not doing altogether really bad compared to the rest of the country. But when you zoom into a smaller scale, you'll see that there are tremendous disparities even within the county. right? And what we started to see, and this is by census tract, that the tracts, which are dark brown in color, which have the lowest access, had 40% or greater number of households with no access to a device, and 60% or greater number of households without an internet connection. So those are some pretty steep numbers there. Next slide, Greg. So based on these initial statistics and trying to figure out, how we could overcome these challenges, the idea really germinated to provide these smart kiosks in strategic locations throughout the community, which would serve as literally huge smartphones that would provide, disseminate critical information on services, programming, etc., to promote community empowerment in the underserved areas. So really, we see this as the first year as a planning exercise in terms of figuring out who our stakeholders were to help us determine community priorities for information delivery, community priorities for kiosk features. So what do folks want to see on the kiosk? What's important to them? And also help establish a network of community partnerships for project implementation at the later phase. The next step was to really identify where the vulnerable neighborhoods were, and then make a data-based decision on where the best locations for the kiosks would be. The next step was to research technology options and look at some feasible solutions. After that, it would be a research on how to develop the prototype apps based on community priorities, and then finally to establish what types of analytical strategies do we recommend to derive insights from all the data that could be collected from these kiosks at the implementation stage, and then how would that ultimately help us on a journey to achieve equity in the long term in the community. Next slide, Greg. So I won't go into great depth about the project milestones themselves, but for communities that are just embarking on their journey or plan to do this in the future, these are some typical tasks that you can anticipate in your upcoming events. And you can see that we did a lot of, we did some stakeholder engagement in terms of survey design, survey deployment. In January, we had we planned for an on-site visit, and we actually had the on-site visit in February, which was a really good stakeholder engagement opportunity for us. And then over the summer, it was a great pleasure to work with one of the smart community interns, and he helped us tremendously in understanding what the surveys were telling us, and doing a literature review on a number of topics, so we could really develop a good short-term and long-term roadmap in this journey for digital equity. Next slide, Greg. In this next section, I'll be talking about some of the research and project actions. And I don't really wish to separate the two, because a lot of the research questions and research design was really guided through the project objectives themselves. So they were really well integrated. So some of the research questions, which really drove some of our tasks that we undertook as part of the project, were what are the optimal kiosk locations? What kind of features should the kiosk have? What kind of app should the kiosk have? What metrics do we use eventually to evaluate the effectiveness of kiosks? And what can Macon-Bibb learn from digital equity strategies across the country? So these were our driving questions, and you will see how we integrated that into our project design and research design. Next slide. Okay. So as I had mentioned on the previous slide, the first step was really undertaking and designing stakeholder engagement. Not surprisingly, we ran into numerous challenges over this, and we have ideas on how we could have done it better. But then, as we all know, we've been tremendously challenged by the COVID pandemic. But thanks to our invaluable project advisors, we were actually able to overcome some of those challenges, and I'll describe those in just a second. But the first step was to determine really community priorities for information delivery. So this project is really about delivering information, critical information, right? So our first quest was to figure out what modes of communication, what modes of information, and what media for information were really helpful. And some of the insights were very helpful. For example, we saw that in certain, this was a survey we did during our on-site event, and it was well attended by a lot of the community representatives, like the Middle Georgia Regional Commission. So they are already in touch with their community residents, and they understand their needs very well. So it was interesting to see, for example, that in terms of what channels through which people trust information, it was also interesting to see that residents believe that strong community engagement and training were two critical aspects in terms of how we could improve information delivery and information consumption. So there were some very interesting aspects that came out in the survey. And then, Greg, those slides have an animation, so you want to click through them. So here we have different results for the types of questions we asked. And then the next step was to really determine community priorities for kiosk features and services. So we needed to ask folks, what types, so if we were developing applications that would go on these kiosks, what types of applications would they want to see in terms of themes? And then what particular features on the kiosk would be most helpful to them? So we developed an online survey for this, and it was ironic because we were trying to reach folks who had poor digital access. So we had, not surprisingly, a very poor response rate for the online surveys, and then we went on to develop an equivalent paper survey. It was an interesting process. So we started with a literal translation of what we had online, and we were really struggling because the pandemic had hit at that point and cities had shut down. So we were at a loss for how we were going to reach these vulnerable populations. Our project advisor, Carol Babcock, stepped right in and had a great idea where there was going to be a food drive in the community. She volunteered, and she said she has a team of people who could actually do these paper surveys. What better way to reach vulnerable populations than through the food drive, because they're very well attended by local residents. So that's how we were able to get a much better survey response, we were able to actually analyze the results, which I will present shortly. The next step was to establish community partnerships, sure enough, we have the Macon-Bibb city government, but we also have our project advisory members, namely Navicent Health, and Carol Babcock is representing today, the Macon Arts Alliance with Julie Wilkerson, and many other partners who at the Middle Georgia Regional Commission, and so on and so forth. Next slide, Greg. So the next step in our research and project timeline was to really identify vulnerable neighborhoods. And we went about this in two ways. So the online surveys and the paper surveys collectively, with the assistance of our committee member, as I already mentioned, we had 215 complete survey responses. We also found from the surveys that grocery stores, churches, and medical facilities emerged as the most popular places for kiosk locations. But if you look at the survey results collectively, you'll see that the 51 to 65 age group consistently appears to be the most vulnerable populations with some of the lowest income ranges and poorest access to broadband and devices. This suggests going forward some potential indicators for the county to prioritize their digital equity efforts and where these communities are. Of course, this is a convenient sample, which means that going forward, if we had to develop a robust evaluation monitoring strategy, we'd have to be more cognizant of our sampling techniques so that they are representative of the entire population. But we mapped the zip codes from where the populations came from, and we had a pretty good representation of these vulnerable tracts. So we feel okay about our survey techniques and our results. Next slide, right? We also did some additional index development and mapping. We use census block groups here, and we downloaded data from the census and the American Community Survey, and we looked at very well-known indicators of vulnerability, whether they were income, education, poverty, and we used some statistical techniques, and we found that the index that was put together using a principal components analysis had the best validation on the ground, which the IT folks validated for us, that was indeed what was going on. We also then overlaid other indicators of vulnerability, such as neighborhoods that are aging or will be aging soon. And when we overlapped those, there were some clear patterns that emerged, particularly in the near and around the downtown Macon area, where they were aging neighborhoods, but also socioeconomically vulnerable. And next slide, Greg. So you can see the neighborhoods there with the hatched census tracts and how they had the aging and vulnerable populations overlaid with them. And the neighborhoods in downtown Macon that have both vulnerabilities, because we also know that aging populations are more at risk for isolation, so all the more reason that they need to be connected. Next slide, correct? We then tried to use a geo-enabled survey component to our online survey, where folks could actually click on specific areas where they would have wanted to see kiosk locations. And that would have been the most ideal way to get this information. Unfortunately, the online survey did not have a great response rate, so we had to resort to paper surveys. And it made it challenging to really ask for specific pinpoint locations. So we got more general information like grocery stores and other public spaces that were important to the community. Next step. So here on the left, you see a map that has kiosk locations that were designated through the geo-enabled survey. But another layer that was added to this was the idea that we also want to initially at least target areas where there's heavy foot traffic, but is also adjacent to these vulnerable neighborhoods. So our community team put together a really good brochure in terms of some candidate locations that would satisfy both conditions. So they would achieve the social benefits as well, but also be in high traffic areas where people would actually interact with these kiosks as they were going about their daily routines. Next slide. The next step was to research potential technology options and identify feasible solutions. So this was again done by the Macon IT team, where they looked at several kiosk models, some that were made within the United States, some we would have to, for example, import from China. Again, those posed a lot of challenges for our project because COVID hit and those supply chains were broken. But I'll talk a little bit about that eventually. Next slide, right? So here's a summary of some of the types of systems that they looked at and the advantages and disadvantages that we compare. So of course, the all-in-one type systems, they come as a complete package with everything included. And companies are willing to offer this at little to no cost, but the disadvantage of that is that if you decide to buy them, they're very highly, the price is pretty high. And we're also relying on advertising revenue to subsidize these costs. And for a smaller city like Macon, that can pose some challenges. And particularly for the population group that we are targeting, that could be even more challenging. The in-house build systems would mean that you would get the basic model and then you would customize it in-house, which shifts the burden of programming and software development to the in-house IT staff. And then with limited time and resources, that can be fairly challenging from a human resource perspective. Next slide. So the next step was something we had already embedded in the survey, was to determine what kiosk features and services would be the most important for the community to see. And among the kiosk features, we saw that free Wi-Fi, payment processing, and touchscreen would be the most important features. And among services, they hope to see services displayed, so apps around government services and resources, election and voting, and public health. And that's a very apt theme for us, considering the pandemic challenge that we are undergoing right now. So those were some of the themes that emerged. Next slide. Go ahead. So we saw that public health services was one of the most important themes that emerged. And considering the currency of that topic and the urgency of that topic, the Macon-Bibb IT team, along with Carol Babcock, were in the process of developing a COVID-related spatial app that gave people information around where testing sites would be. And Carol has some ideas around how that can be expanded, and she will talk to that later on as we have the panel discussion. Next slide. Good. So the last step was to really look at, well, not really the last step, but one of the towards the end, it was to establish, if we got a kiosk, if we got a prototype, what would we do with that information? What types of insights would we gather? So this is an infographic that suggests some machine learning and AI analytical strategies that could be used to derive insights. And this is really based on the stage of the implementation. So the first stage would be a prototype kiosk, and the types of information that we would look for is to understand patterns of usage, patterns of consumption, how people are using the information, and then synthesize this information to really understand segments of population. So using clustering and segmentation algorithms, we would really look at groups of populations within the community and really be able to figure out what are those customized needs, right? And then if we had the opportunity to scale up this intervention, where we would have different types of kiosks and different types of locations and contexts reaching a much larger set of people, we would be able to likewise scale up the analytical strategy, where we would be able to then optimize kiosk locations in all of these different locations and give customizable programming. And also, we would be able to develop really deep insights into the different types of groups that exist, not just based on demographics and age, but also different preferences and so many other types of things. But in the end of the day, how does this take us to equity? So if we start to figure out what are these clusters of people and what are their consumption patterns, we can then design, for example, if we these are algorithms that Amazon and Google use, for example, using like a market basket analysis or an affinity analysis to really understand how we can group interventions along with needs. So if a person using the kiosks were to use food related, so either food stamps or that kind of information, along with the need for transportation services such as NEMT or other types of services, and also had young children, then we can design customized interventions where we approach equity in a much more holistic way. So it's no longer just about digital equity, but it's about social equity, and we can design these packaged solutions for folks based on these clusters that we identify within the city population. Next slide, correct? So these are some further details in terms of some indicators that we will be measuring to understand patterns of asset usage, identify patterns of consumption, and then collectively put that together to really understand end user segments and what are the different subtypes or population groups. It's not unlike marketing analysis strategies. So these were just some ideas we had, which we would readily be able to deploy if we were able to get a prototype kiosk. Next slide, right? So this project is not just about the kiosk itself, but it's about a larger effort to really promote digital equity within the community, right? So we looked at a very well-known definition of digital inclusion that is defined by the National Digital Inclusion Alliance. So what is digital equity and how they define it? So one is to have an affordable and reliable access to broadband and internet services, availability of internet-enabled devices, access to resources that enable digital literacy, self-sufficiency, participation, and collaboration. So all in all, community empowerment, right? Quality technical support, and then intentional strategies to reduce or eliminate historical, institutional, structural barriers to the access and use of technology. So if you look at these 5 checkpoints, we've hit one of them, where you see the green check mark. So the next step was to really give Macon the information on what some other cities are doing, and we can go to the next slide. So what we did was, and this is where our Georgia Smart intern really helped us put together this database or inventory of some digital equity plans that were being created across the country. So you have a list of the cities there, and we standardized the different categories of strategies that they had, and we have a much more detailed inventory of this that we will be submitting with our report in terms of specific indicators and specific action strategies that were undertaken under each of these categories. So this would be a very helpful reference document for Macon or any other community that wishes to undertake a digital equity initiative to look at how different communities are going about doing this. And these are all fairly new, so they haven't reached a level of maturity yet to be able to evaluate whether they've been successful or not, but definitely gives us some sort of a roadmap in terms of what is happening around the country. Next slide, correct? So along the way, I've mentioned some challenges and recommendations. I think that some of the challenges we had, and we've heard other communities speak to it as well, just staff and budget shifts. And for those of you who are embarking on in the new cohort, particularly in the light of how city budgets have been impacted by COVID, we always recommend having some redundancy built into your personnel plans so the project is able to proceed smoothly. But also, COVID was our biggest challenge. We had a lot of issues with a very meaningful community engagement, a more thorough community engagement. Our survey data collection, luckily, thanks to our project advisory committee, we were able to recover and get some meaningful insights. but also for more meaningful stakeholder engagement. For example, we'd have liked to see much more in-depth involvement in terms of developing evaluation metrics and understanding how stakeholders think about what is important to be measured, what is important that we need to keep following up, so hopefully we'll be able to do that in the next phase as we select indicators. Our literature review has a rich list of indicators, but we would definitely like to get community insight into what those indicators look like. In fact, we had hoped that over the summer our intern would have been able to help us with some of that community engagement, but unfortunately, the interns were not able to immerse themselves in the community due to the pandemic. The other big challenge we had was acquiring the kiosk itself. We'd initially thought that we would acquire, a basic kiosk, perhaps from a Chinese model, and then customize it in-house to give us more control on what goes on it. Unfortunately, that was not meant to be because those supply chains broke down. And then we have been really trying to wrap our heads around how we get a local model, and we continue to do that. And hopefully we will see some success around that shortly. Next slide, Greg. So this is a quote from Dr. Moffitt regarding his aspirations for the project, and I will let him speak to that a little bit as we move to our panel discussion. And Greg, next slide. So in terms of a future roadmap and what we hope to see, the next step would really be acquiring a prototype kiosk and deploying some of those analytical strategies that we had designed, and really start gaining insight into, how well the kiosk is working and what folks are really using and doing with that information. Future funding, we continue to explore that both through public-private partnerships. We did apply for a Knight Foundation grant. We made it to the final round. Unfortunately, we didn't get selected, but there's a lot of other opportunities out there, a lot of foundation grants that we are aiming for, and of course the NSF Smart and Connected Communities, as and when we see that some of our projects align with their thematic areas. And next slide, Greg. So I'd like to wrap up the presentation in looking at how this project has been received so far, and what aspirations are there for this project going forward. And these few slides were put together by Julie Wilkerson, who is also on our project advisory committee. And she is the director of the Macon Arts Alliance. And I'll briefly talk about in slide 28, where she talks about how her involvement in the whole project for the last 1 year, she's given us a lot of really neat insights. She was at the on-site event. Next slide, Brett. So how she sees the project benefiting Macon Arts Alliance is really getting the community involved in cultural initiatives, informing residents of cultural programming, collecting data on where cultural assets are and located and where they're lacking. So really filling gaps in that respect, and then also making data-driven decisions about supporting neighborhood cultural assets and cultural programming, so that this is available to a wide range of people of all age groups, of all socioeconomic backgrounds, and really getting the community involved in the cultural programming that the community offers. Next slide. Okay. So I'd like to conclude the presentation. You have our contact information. We are always available to answer any questions, and please feel free to reach out to us if there's anything we can help with, or help you understand better as you undertake your own community projects. We would absolutely be delighted to be of assistance. And we will now move on to a panel discussion with Dr. Moffitt and Carol Babcock.
Hey, thanks, Artie, and welcome, Carol, and welcome, Keith. I would encourage everyone to use the Q&A area here in Blue Jeans to ask your questions of the Macon-Bibb team and Artie, the GT Research partner for this project. I'll just kick it off very, very briefly with this project is really amazing in looking at improving the equity in the Macon-Bibb region. And I'm curious, Dr. Moffitt, I know that Macon-Bibb has a lot of smart cities projects that you're working on as a community, and I'm just interested to hear your take on where this fits in with those projects and its importance in driving the community forward.
Well, this project is a perfect fit for our community engagement aspect as we try to build a bridge to that digital divide that we know. If COVID has taught us anything, it has shown us that we do have a over-dependence on technology at this point. I know all of us have been in all these Zoom meetings, and the virtual world is just growing. So this project allows us to put technology into our most underserved community in places that we know that we have citizens pooling together, like at our rec centers, at our libraries, in our downtown areas. Having these kiosks is a way that they can have information right at their fingertips. And I've just been blown away by the technology in the device itself. Carol's going to share some of the health technology that are in these kiosks that you can do temperature scans right there. So, when we have our restaurants that are doing temperature scans for people to go in before you even get to the door of the restaurant, you can go to these kiosks and check your temperature and things of that nature. So I've just been blown away at just the interaction that the community will have with the government through this technology. So I'll let Carol speak on the health aspect that combines with these wonderful kiosks.
Okay, thank you. So I'm Carol Babcock, and I'm actually the Director of Population Health at Navicent Health. And we've been on a long journey of really working toward improving health equity. So this project together is just taking us to the next level. One of the biggest gaps that we have is reaching all of the residents in Macon-Bibb County and getting them the information they need, and bringing those types of screenings and things that we need to do to be able to identify that someone has an issue that needs to be addressed. A lot of people don't like to go to a doctor or don't feel that they may need to go, but there may be an underlying issue that needs to be addressed that they don't even realize they have. So some of those items are being able to check blood pressures, doing some little risk surveys and things that would allow people to be able to track and be able to see if there's an issue that they have where they may be a possible diabetic or have heart issues. It can also lead them to all of the different programs that we are trying to provide in our vulnerable communities. And it was really eye-opening to find out how many people don't have access to even a computer or a smartphone, and being able to really pinpoint those areas that we needed to focus on.
So, Carol, the current pandemic that we're in and this type of technology to be able to get information out to people, at a hospital or something, where the information is changing rapidly and putting something in the mail isn't quick enough. Can you speak to, how this particular technology could impact the health services industry, in particular in you?
Absolutely. I think the one thing COVID has taught us is to all be more prepared for fast-moving information and how to disseminate it across all areas and being able to get it. The ones that were most affected by mortality and morbidity of COVID-19 were those that are living in these vulnerable areas. So we were actually able to work with putting together an app to be able to show where do you go to get tested. And each testing site was so different because there was different capabilities. And so for people to not know where to go that have trouble with transportation and those types of things, it was really very important for us to be able to disseminate information very quickly that says where's the right place to get this information. It also allows for quick screenings and to be able to rule out whether you are high risk or whether you need to be more sheltered. Also giving out the governmental information that was coming of wearing masks and what was available for care out in the community as well.
Thank you. So again, I'll just ask anyone out as an attendee, if you do have questions, please feel free to use the Q&A area as we continue this discussion. So one thing that kind of really hits me is that the population that you all are trying to reach, is a population that's not necessarily familiar with technology itself. They probably don't have a smartphone. They probably have not used a computer that often. So did you find that in trying to reach these people and let them know about this type of technology that you were trying to make available, were people receptive, or did they say, "Oh, that's technology. I'm scared of that. I don't know how to use that. How is that really going to help me?" Did you encounter that type of mentality, and how might we get over that?
So I think that I have one quick aspect of our surveys that I'd like to comment on, and Carol was instrumental in pointing this to us. So when we did the first iteration of the paper survey, we realized that we had words like kiosk in it, and a lot of folks who were taking the survey were not clear what a kiosk was, and we had to, so Carol's team had to do a lot of explaining. Right, Carol, in terms of figuring out, what a kiosk was, what it looked like, what it does. Unfortunately, we had actually revised our survey, but we couldn't get to a second round where we had a very user-friendly survey with visuals and icons where folks could actually understand, what a kiosk was and what it could do. So that's one aspect of communicating clearly, or communicating at the level at which folks can understand and receive information. So that was a big lesson for us in terms of how we design surveys even.
The interesting thing, though, when we were doing those surveys, I was actually hands-on there and was helping to explain to individuals what we were trying to do. And there was a lot of excitement around it. And I think everyone would welcome the whole concept, and putting it in places that are close to where they live and being able to access them. They really quickly were able to give us some great insight of where that would be. Grocery stores, churches, some of the, interestingly, medical facilities like our emergency department. We see thousands of people, and it's a good chance for, if a patient is being waiting and seeing a doctor, their family has access to be able to get more information and be able to look at how they can manage this once they get home, and have access to the different programs that are out there. So it's really very well received in our community.
Excellent, great news. So we did have a question come in asking if the community plans to scale up the project. So that really kind of is along the lines of what are the next steps? Where does the community see this project going? in the future, and how big of an impact they have?
Yes, we would like this project to be in every community that needs it. The pilot project is, I believe, about a 10 block or a mile radius in our downtown area, which encompasses a couple of neighborhoods. But again, when we showed this project to the commissioners, everyone was eager to have it in their district. So they would definitely love us to grow this project and get it in every possible neighborhood that needs it.
We are also looking from the medical side of being able to get that healthcare information. Some of the foundation grants, we're looking at some of the medical benefit to this, and we're hoping from our side on the hospital that we can actually have some of these located in some of the vulnerable clinics that we run in Macon. So we probably will be partnering very closely with Macon-Bibb County to make that happen.
Excellent. Okay, again, I'll just ask if anyone has any questions, please feel free to submit them. But if we don't have any more questions, I'll just kind of pose one more ask of all of you, and to just kind of give us your last parting thoughts on what you all as a community really learned from this project and the impact that it's having, and really just anything else that you want to mention to our audience members.
I believe I've learned, again, anything is possible. Again, I tell you, this just started by us talking amongst ourselves or throwing some ideas out there, identifying a need. At the same time, opportunity presented itself to find a funding source through Georgia Tech, which became more than a funding source. It became an informational source. So yes, the funding is good, but just the fact that we were able to partner with Georgia Tech and professors and things of that nature just help us think through this idea. We're able to do the survey to get more information that just solidified the process and what needed to happen. And then opportunity presented itself with a company in Atlanta, had the kiosk and was looking at a way to get into communities. So we've already tried to take that idea and already what information do we want to make sure is included on the kiosk when it comes to interacting with your government, that knowledge base, and not just the government, the other nonprofits that have resources. We have a growing homeless population here. And so we know that these kiosks in the right location, it could get information about the resources we can have for the homeless. I mean, again, that idea was not even on the forefront when we first started talking, but now it has kind of morphed into what are those services and information that we definitely want to get into the community. And this can be a brainstorm way of making that happen very quickly. The person that controls it, all we have to do is just send them the message and they input it into the system and boom, it's displaying right there in the kiosk. So every weekend or every day we can have a different message out there. We can have different information out there. And again, that makes my job a whole lot easier, especially when we talk about emergency conditions or community activities. So I'm just excited to see this project come to reality. So that's what I've learned from it, is just, just taking it day by day and just growing it.
I'll just say real quickly that I learned that Macon-Bibb County has a lot of movement going on. We have a lot of like-minded people that are really passionate about bringing projects like this to fruition. The partnership with Artie and her team has been amazing. And I think this is only the beginning of many more things to come. We've all been sharing our vision of improvement in equity overall for our community. So it's just exciting how this is kind of taken us to the next stage of pulling together a great team.
And I'd like to add to that and say that the potential for the types of data we can collect and layer that with the analytical strategies that we have lined up and be able to put all that together to actually define a more holistic approach to promoting social equity. To me, that is extremely exciting. And it's a very creative approach, and I think that has so much potential because we know that public social services are fragmented in terms of that data basis, right? But this helps us to see it all together in one shot in terms of how people are using or consuming information. So we have a much more integrated way of looking at multiple social services that can be offered to folks.
Excellent. Thank you all. There was one quick question that did come in. It looks like there's an IT services provider on the line in your community, and if you're open to working with them on this project or in the IoT space in the future.
Yes.
Okay.
Yes, and forgive me if we not already made contact with this provider. One thing that I did was create an advisory board, which I tried to find all the stakeholders that had anything going on with what we perceive smart cities. And we've had a couple of meetings to discuss all the projects and make sure that everyone knew, the right hand knew what the left hand was doing. So if there's somebody out there in the middle Georgia, not just Macon, a middle Georgia community that definitely would like to be a part of this, just contact our office and we will make it happen. Our door is open, and again, this is for the benefit of the community. So that's our only goal. So anybody that can add value, we definitely like you to be on the team.
Excellent. Thanks, Dr. Moffitt. So that concludes today's webinar today. Thank you very much, Artie, Carol, and Keith, talking about Macon-Bibb's Georgia Smart project for the past year. So thank you all attendees. Like I said earlier, we will continue the Smarter Together webinar here into the fall. So we'll have our next Smarter Together webinar here next Thursday at noon. So please check our website for the fall lineup. And thank you everyone for attending. Have a great afternoon.
Thank you. It's been a pleasure.